Bismillahirrahmanirrahim. In the name of Allah, the most beneficent, the most merciful. Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. Assalamu alaikum, everyone. I'm Dr. Momena Zia. I'm an MPhil trainee in the Department of Community Medicine, and today I'm going to present the topic of essential drugs, mainly focusing on disinfectants under kind supervision of my professor, Dr. Saira Afzal. Learning outlines for this presentation will be essential drugs, essential drug list, also known as EDL, classification of these drugs, disinfectants, classes of disinfectants, and properties of disinfectants. What is eco-friendly disinfectant? Chlorine as a disinfectant, disinfection of hospitals, benefits and drawbacks of these disinfectants, recent updates, and MCQs. So the objective by the end of this discussion, participants will be able to describe these essential drugs and disinfectants, their classes and properties, as well as their use in hospitals. What are essential drugs? These are the medicines that are intended to be available within the context of functioning health systems at all times, in adequate amounts, in the appropriate dosage, with assured quality, and at a price that individuals and the community can afford. In terms of access, it is defined as having medicines continuously available and affordable at public or private health facilities or medicine outlets that are within 1 hour's walk of population. In terms of quality, it is represented by the absence of expired stock on pharmacy shelves in adequate handling and conservation conditions. Rational use is measured by examining prescribing and dispensing practices, standard treatment guidelines, and the essential medicines list. It is recommended that all surveys collect data on the global list of 14 medicines, which is included in WHO or hospital-acquired infection survey, and preferably 16 regionally specific medicines. In addition, countries are encouraged to collect data on a further 20 medicines of national importance. It is recommended that a national survey of medicine prices and availability be conducted every 3 to 5 years using the WHO HAI standard methodology. So essential medicines, they are defined as those that fulfill the priority health care needs of majority of population. They should therefore be available at all times in adequate amounts and in the appropriate dosage forms and at a price that individuals and the community can afford. Moving on to essential drug list. The first national essential medicine list of Pakistan, it was prepared in 1994. Multiple revisions were then occurred in 1995, then in 2000, 2003, 2007, 2013, and the last updated list was given in 2018, which contained 428 molecules, 30 categories, and 78 subcategories, and they were classified for use at primary, secondary, and tertiary levels of healthcare. Now the question arises, how we determine the list of essential drugs in any nation? It is mostly based on, number one, morbidity patterns, seasonal trend, number two, sickness load, number three, level of healthcare service and competency of health manpower, and number five, the common medicines which are included are ORS packets, antimalarial painkillers, including paracetamol, antipyretics, antibiotics, bronchodilators, iron ointments or drops, anti-snake venoms, vaccines as per EPI schedule, or oral contraceptive pills, antiseptics, band-aids, or cotton. Then example of these are given in the table. Have a look at this table. For asthma, the essential drug is salbutamol. Strength is 0.1 mg per dose, and the dosage form is the inhaler. For diabetes, glibenclamide, 5 mg capsule or tablet, cardiovascular disease, atenolol, captopril, simvastatin, and for depression, amitriptyline. For infectious diseases, Cipro first line, cotrimoxazole, amoxicillin, and ceftriaxone. For CNS disease, diazepam. For pain or inflammation, diclofenac, or paracetamol, and for ulcers, gastric ulcers, omeprazole. The strengths and dosage are given. So these are few examples of essential drugs that are used for different conditions, along with their strengths and dosage form. Moving on to hospital formulary. So it is a list of available medicines in hospitals. No hospital pharmacy can stock every medicine that doctors may want to prescribe. Therefore, the medical and pharmacy staffs of hospitals make up a hospital formulary, which is a list of medications that the hospital pharmacy stocks, along with information about each medication. The committee that complies the hospital pharmacy meets regularly to make changes as necessary. The purpose of this hospital formulary is that doctors, they use the formulary to find out which medications the hospital has available to treat a certain symptom or a condition. Moving on to the classification of these essential drugs, these can be oral drugs, there can be injectable drugs, infusion fluids, vaccines or immunoglobulins or anti-serums, drugs for external use or antiseptics, and disinfectants. Now we're going to see in detail what disinfectants are. So a chemical agent that is used especially on hard surfaces and in water, such as drinking water or wastewater, to destroy, inactivate, or significantly reduce the concentration of pathogens, such as bacteria, viruses, or fungi, is known as disinfectant. Moving on to the classification of disinfectant, these can be natural agents like sunlight and ventilation, air, physical agents like incineration, hot air boiling, autoclaving, ionizing radiations, and chemical agents. Moving on to the detail of chemical agents, we have phenol and related compounds, which include phenol, crude phenol, cresol, emulsions, chlorhexidine, hexachlorophenol, and Dettol. Then there comes quaternary ammonia compounds, halogens and their compounds, which includes bleaching powder, sodium hypochlorite, halazone tablets, iodine iodophores, alcohols, formaldehyde, and miscellaneous, which includes lime and ethylene dioxide. Properties of an ideal disinfectant. An ideal disinfectant should have a broad spectrum of action, antimicrobial action. It should be fast acting and produce a rapid killing action in single application. It shouldn't be affected by environmental factors. It should be non-toxic and non-irritating to user. Surface compatibility should not corrode instruments and metallic surfaces. And persistently used, on persistence use, it should have sustained antimicrobial activity, like it does not lead to the development of resistance in microbes. Easy to use, acceptable odor, economical, cost should not be very high, soluble in water and stable in concentrates, as they can be used for dilution. They should be cleaner and non-inflammable. Now, moving on to the properties of certain disinfectants that we have. Number one is 70% ethanol. Number two is sodium hypochlorite. Number three is hydrogen peroxide and parachloromethylcresol. In terms of 70% ethanol, it has a pungent odor. It is quite irritable to skin, respiratory mucosa, and it is highly corrosive for the instruments. It is flammable. It catches fire. In case of prolonged contact with skin, it causes irritation and allergies. And its mode of action is quite short acting. We have to apply it again and again after some time. The sterilization efficacy is quite low. Moving on to sodium hypochlorite. It also contains some kind of an odor. It is highly irritable for the respiratory mucosa and skin, and to lesser extent for skin. In terms of corrosiveness, it is not very much corrosive as compared to 70% ethanol. However, it is a strong carcinogen, and its mode of action is also short acting. It has low sterilization efficacy and speed. Hydrogen peroxide is odorless, but it is irritable to skin and mucosa. Less corrosive ability as compared to the other disinfectants. The duration of action is also short acting, so frequent applications are required to achieve maximum sterilization. Medium sterilizing efficacy. However, in terms of its drawbacks, it has the tendency to cause severe blindness when it comes in contact with eyes. Or it can cause tissue necrosis, or it can cause pulmonary edema in case of prolonged exposure. Moving on to the last, parachloromethylcresol. It's highly irritable to skin and eyes and respiratory tract. It is highly corrosive. Mode of action, duration of action is also short acting. The efficacy is also very low. It has a pungent odor, and it has toxic and various side effects. Overexposure of this disinfectant to a certain individual can also lead to death. In view of above all the drawbacks, there should be a disinfectant that should minimize the waste. It shouldn't be toxic. And this kind of a disinfectant is known as an eco-friendly disinfectant. Eco-friendly cleaning products, they are made to not harm the environment and ecosystems. This could mean minimizing waste, toxic chemicals, and other environmental hazards. One such example is silver nanoparticles. They have been shown by many researchers to be a very safe and highly effective disinfectant. It is also available in Pakistan. Now we're going to see some of the properties of silver nanoparticles. In terms of odor, it is odorless. In terms of its safety parameter, it is quite safe because there is no irritability or corrosiveness seen along with its use. It's quite fast in action with high sterilizing efficacy, and with one application of disinfectant, quite high antimicrobial activity is seen. It's a long-acting disinfectant. In case of drawbacks, no drawbacks were noted. So recently we have this COVID-19 outbreak, and during that time, disinfection was required. So in case of this COVID-19, it is a lipid-containing virus, so it can be killed with simple wipes containing alcohol. So copper surfaces tends to kill virus in 4 hours, while disinfecting surfaces within 62 to 71% alcohol or 5% hydrogen peroxide bleach, it kills virus within a minute. The frequency of disinfection, it should be according to the viability, which is different for different materials, with a minimum of 2 hours for plastic and stainless steel to a maximum of several days, 2 to 4 days or 7 days on clothing, depending upon the type of clothing and the outer layer of the surgical mask. So chemical disinfectants are mostly used for disinfection of COVID-19 virus, which includes quaternary ammonia, hydrogen peroxide, sodium hypochlorite, and sodium chloride. It can be used. Heat can also be used, but it is very important to heat a particular utensil or anything that is infected for 15 minutes at 92 degrees Celsius. Only then the virus will be dead. Chlorine is mostly used as a disinfectant. So chlorine solutions of different concentrations, they are most commonly used, and it has bactericidal, tuberculosidal, and fungicidal activity. So it's also active against viruses like hepatitis B and C and HIV, and it has a sporicidal activity. It also may kill spores of the bacteria. It is used for the treatment of water, surface disinfection, instruments, and linen. So 2 different types of solutions of bleach are used with 2 different types of dilution. Number 1 is 1 in 10 bleach solution, which is equals to 0.5% of chlorine, and it is used for disinfecting the excreta, bodies, spills of body or body fluids, vehicles, and tires. It is also used to prepare 1 in 100 bleach solution. And that 1 in 100 bleach solution is equals to 0.05% of chlorine for disinfecting surfaces and medical equipments, bedding, reusable protective clothing before it is laundered. There are also certain drawbacks of chlorine as a disinfectant. Chlorine solution, they gradually lose strength. So freshly prepared and diluted solutions, they may therefore be used and prepared daily. Clear water, it should be used because organic matter destroys chlorine. So there shouldn't be any ambiguity or any 1 in 10 bleach solution is caustic, so avoid direct contact with skin and eyes. Bleach solutions, they give off chlorine, hence prepare them in a well-ventilated area to avoid the vapors. Use plastic containers for mixing and strong bleach solutions, as metal containers are corroded rapidly and also affect the bleach. Disinfection of hands is quite important in a medical practice. So the principal means for disinfecting hands is by washing with soap and water. If available, a commercial hand disinfectant containing alcohol, chlorhexidine, or povidone iodine could be used. The use of strong chlorine solutions, such as 1 in 100 chlorine solutions, they should be avoided as it is dangerous and can cause irritation, allergy, eczema, or other skin-related issues. So this is a picture which illustrates the hand rubbing motions in hand washing and hand disinfection, which is based on the WHO protocol. Number 1 is rub palm to palm. Number 2 is palm to palm with interlaced fingers. 3 is palm over dorsum and interlaced fingers. Then comes rotational rubbing of thumb, back of the fingers, palms, interlocked, and rotation of nails, rotational rubbing of wrist, then rinse and dry. Moving on to the hospital disinfection. Here we come upon two terminologies. One is sterilization and one is disinfection. Sterilization refers to, while disinfection is the process of eliminating or reducing harmful microorganisms from inanimate or hard objects and surfaces, sterilization is the process of killing all microorganisms. It is done for critical items that will enter the tissue or vascular system or blood will flow through them. Now, disinfection is done for semi-critical or non-critical items, and it has following types. High-level disinfection, which is HLD, intermediate level disinfection, ILD, low-level disinfection, which is LLD. Here we have a comparison of these three types of disinfections. The high-level disinfection, it disinfects semi-critical items that will come in contact with mucous membrane or non-intact skin with glutaraldehyde-based formulations, hydrogen peroxide, and hypochlorite. Pasteurization may be an alternative to HLD. Exposure time of disinfectant will be for 12 to 30 minutes at more than or equal to 20 degrees Celsius. This high level of disinfection is used for disinfecting endoscopes, ETT, endotracheal tube, anesthesia, breathing circuits, and respiratory therapy equipment that touch either the mucous membranes or non-intact skin. Moving on to the intermediate level of disinfection, it is not much used in hospital disinfection and is for some semi-critical items, and non-critical items. In case of the low-level disinfection, this is for non-critical items that will come in contact with intact skin, both done with ethyl or isopropyl alcohol, sodium hypochlorite, phenolic germicidal detergents, iodophor germicidal detergents, and quaternary ammonia. Exposure time for the disinfectant will be more than or equal to 1 minute. So there are certain hospital disinfection guidelines or SOPs that must be followed in order to achieve germ-free hospital. Low-level disinfection is used for non-critical patient care surfaces like bed rails and bed tables and equipments, for example, BP cup that touch intact skin. These items, they should be disinfected on regular basis or whenever they are soiled. Clean the walls, blinds, and window curtains in patient care areas when these surfaces are visibly contaminated or soiled. On the other hand, decontaminate the mop heads and cleaning cloths regularly to prevent the contamination. Replace the floor mopping solution, preferably diluted chlorine solution, every 3-patient room. Detergent and water are adequate for cleaning surfaces in non-patient care areas. Do not use the high levels of disinfectants for disinfection of non-critical surfaces. Now, wet dust the horizontal surfaces regularly, for example, 3 times per day in a week. Use clean cloth moistened with a detergent or disinfectant. Clean and decontaminate spills of blood and other potentially infectious materials promptly. Discard blood contaminated items in compliance with SOPs. Use gloves and PPE for this handling. For small spills of less than 10 ml of either blood or infectious material, use 1 in 100 dilution chlorine solution, as we've discussed earlier. And for large spills of more than 10 ml, use a 1 in 10 dilution chlorine solution before cleaning. Following this decontamination process with a terminal disinfection using a 1 in 100 dilution of chlorine solution. There is one other drawback which is seen with most of the detergents is the presence or development of resistance against these disinfectants in microbes. So this figure shows at the top, there are prions, spores, and mycobacteria. These are the most resistant, they can become most resistant to the disinfectants. And at the bottom, there are enveloped viruses, which are the least resistant to disinfectants. In between are non-enveloped viruses, mostly the noroviruses, and fungi, and different types of bacteria. In terms of spores, Clostridium difficile spores, they are the most resistant ones. Moving on to the recent updates regarding these disinfectants is, number 1, post-treatment disinfection or technologies for sustainable removal of antibiotic residues and antimicrobial resistant bacteria from hospital wastewater. So the abstract shows the WHO has identified antimicrobial resistance bacteria and its spread as one of the most serious threats to public health and the environment in the 21st century. Different treatment scenarios are found in several countries, each with their own regulations and selection criteria for the effluent quality and management practices of hospital wastewater. To prevent the spread of disease outbreaks and other environmental threats, the development of sustainable treatment techniques that remove all antibiotics and antimicrobial resistant bacteria and genes, they should be required. Although few research-based articles published focusing this issue, explaining the drawbacks and effectiveness of post-treatment disinfection strategies for eliminating antibiotic residues and antimicrobial resistance from hospital wastewater. It is the reason of this review. The application of conventional activated sludge CAS in large-scale hospital wastewater treatment poses high energy supply needs for aeration, capital, and operational costs. Membrane bioreactors, MBRs. They have also progressively replaced the conventional activated sludge treatment systems and achieved better treatment potential, but membrane fouling, energy costs for aeration, and membrane permeability loss restrict their performance at large-scale operations. In addition, the membrane process alone doesn't completely remove or degrade these micropollutants. As a substitute, the pollutants are being concentrated in a smaller volume, which requires further post-treatment. Therefore, these drawbacks they should be solved by developing advanced technique to be integrated into any of these or other secondary waste water treatment systems, aiming for the effective removal of these micropollutants. The purpose of this paper is to review the performance of post-treatment disinfection technologies in the removal of antibiotics, antimicrobials, resistant bacteria, and their genes from hospital wastewater. The performance of advanced disinfectant technologies like granular and powdered activated carbon adsorption, ozonation, UV radiation, disinfections, phytoremediation, and other integrated post-treatment techniques are primarily reviewed. This is another one, microbiological impacts of decontamination of stethoscope and assessments of disinfecting practices among physicians in Pakistan, a quality improvement survey. This survey showed that the use of contaminated diaphragms of stethoscopes have infected most patients. So before decontamination of diaphragms with isopropyl alcohol, the disinfectant used in this research, 27 diaphragms had grown while 51 had no growth. After decontamination with isopropyl alcohol, 5 had growth while 73 had no growth. So another one is rate of microbial contamination in operation theaters of allied hospitals of Faisalabad before and after fumigation. So what they have done is a quasi-experimental study was performed by collecting samples from operation theaters of allied hospital Faisalabad. Sample includes swabbing from surfaces of sites of operation theaters with a sterile cotton swab moistened with saline. And it was rubbed on various surfaces of operation tables, instrument trolleys, walls, OT lights, suction machines, and anesthesia machines. So a total of 96 swabs, they were growth positive before fumigation and 13 after fumigation. So total reduction rate after fumigation was 19. Fumigation is effective, but it is toxic, as the methodology involves the use of toxic vapors of formalin and requires prolonged exposure, closure of the theaters up to 72 hours. It is difficult to perform on a regular and frequent basis. So it was suggested that instead of the formaldehyde fumigation, fumigation with hydrogen peracetic acid vapors should be done. Now, moving on to the MCQ part. Number 1, a 45-year-old male patient presents to the emergency department with severe hypertension, blood pressure of 180 by 110 millimeters mercury. He has a history of hypertension, but has been compliant with his medication regime. So the physician decides to start him on an essential antihypertensive drug. Which of the following essential drug is the most appropriate choice for the initial management of this patient's severe hypertension? A is amlodipine, B is hydrochlorothiazide, D
B.
D, a beta blocker, labetalol would be the correct answer. 2, a 35-year-old male presents to clinic with complaints of persistent cough and wheezing. He has a history of asthma but has been non-compliant with his inhaler therapy. His symptoms have worsened over the past week. Yeah. And he is now experiencing difficulty breathing, especially at night. The physician decides to prescribe a medication to help control his asthma. Which of the following essential drug is the most appropriate choice for this patient to provide immediate relief from his asthma symptoms? Salmeterol, B, budesonide, C, albuterol, D, montelukast, E, theophylline.
C.
Yes, C, albuterol, a short-acting beta agonist, is the correct answer. A 55-year-old man with a 10-year history of type 2 diabetes presents for a routine checkup. His HbA1c is 7.8 and his lipid profile shows elevated LDL cholesterol, which is 160 milligrams per deciliter and tags to be 200 milligrams per deciliter. He is currently on metformin for diabetes. The physician wants to start a medication that will help control both his blood sugar and cholesterol while minimizing the side effects. Which of the following essential drug would be the most appropriate choice for this patient? A is atorvastatin, B is glipizide, C is rosiglitazone, D is sitagliptin, E is simvastatin.
Atorvastatin or simvastatin.
Yes, A atorvastatin. Fourth, a hospital infection control officer is conducting a training session for the staff about the importance of maintaining a sterile environment. During the session, she explains that certain agents are used to eliminate or reduce necessarily on living tissue. She emphasizes the importance of using the correct type of agent to prevent infections in patients. Which of the following best defines a disinfectant as described in training session? A, an agent that destroys all forms of microbial life, including spores. B, an agent that reduces the number of microorganisms to a safe level on living tissues. C, an agent used to eliminate pathogenic microorganisms on inanimate surfaces. D, an agent that prevents the growth of bacteria without killing them. E, an agent that is used for sterilization and surgical procedures.
C.
So the correct answer is C, an agent that is used to eliminate pathogenic microorganisms or inanimate surfaces. 5, a local health department is evaluating different disinfectants for use in public spaces such as schools and community centers. The team wants to select a disinfectant that not only effectively kills pathogens but also meets several important criteria. They are looking for a disinfectant that is fast-acting, safe for human health, and compatible with various surfaces and stable in storage. Which of the following properties should be the health department using or prioritized when selecting an ideal disinfectant? A, highly toxic to ensure maximum effectiveness against pathogens. B, broad spectrum efficacy against a wide range of microorganisms. C, long shelf life and no need for dilution before use. D, ability to leave a residual effect on surfaces after application. E, all of the above.
B.
Yes, broad spectrum efficacy against a wide range of microorganisms would be the ideal. 6, a small business owner is looking to switch to eco-friendly cleaning products for her cafe as she wants to minimize the environmental impact of her operations. She is particularly interested in using disinfectants that are effective against common pathogens but are also safe for the environment and her customers. She reads about various options and their properties. Which of the following characteristics should the business owner look for in an eco-friendly disinfectant? A, contains harsh chemicals that can cause irritation. B, biodegradable and made from natural ingredients. C, effective only against bacteria but not viruses or fungi. D, produces harmful fumes when used. E, requires high concentrations for effectiveness.
B.
Yes, B is the correct answer. 7, a community health center is preparing to implement a disinfection protocol using chlorine as a disinfectant for water treatment and surface sanitation. The staff is reviewing how to properly prepare and use chlorine solutions to ensure effective disinfection while maintaining safety standards. Which of the following steps should the health center staff prioritize when preparing chlorine as a disinfectant? A, diluting the chlorine solution with hot water to enhance effectiveness. B, using the chlorine solution immediately after preparation to ensure maximum efficacy. C, storing the prepared chlorine solution in direct sunlight to prevent degradation. D, mixing different types of chlorine like bleach and calcium hypochlorite for enhanced potency. Preparing the chlorine solution without following manufacturer guidelines for concentration and contact time. B is the correct answer, using chlorine solution immediately after preparation to ensure maximum efficacy.
B.
Yes, B. 8, a hospital is considering implementing fumigation as a method for disinfecting patient area and operating rooms. The infection control team is meeting to discuss the potential benefits and drawbacks of this method. They want to ensure that the chosen disinfection strategy is effective and safe for both patients and staff. Which of the following is significant drawback of using fumigation as a disinfection method in hospitals? A, it is a process that requires minimal preparation. B, fumigation can leave harmful residues that may affect sensitive equipment. C, it is highly effective against a broad spectrum of pathogens, including spores. D, the process can be performed a local health department is launching a public awareness campaign to educate the community about the importance of regular disinfection in homes and